In this video, I'll guide you through the differences between PET and SPECT. In short, PET and SPECT are two primary imaging techniques in nuclear medicine. They use small amounts of radioactive tracers to create detailed pictures of our bodies. Unlike X-rays, CT, or MRI scans that show how our body looks, PET and SPECT show how our organs function. With their unique ability to assess biochemical processes in the body, these scans can detect changes occurring in the earliest disease stages, well before any anatomical alterations emerge. This is why these techniques are frequently used in oncology. PET, for example, can identify cancer approximately 6 months earlier than CT scans. PET stands for positron emission tomography. As the name implies, it uses positron-emitting radioisotopes. A positron is a positively charged particle released during the decay process. The most frequently used radioisotope in PET is fluorine-18. On the other hand, SPECT stands for single-photon emission tomography and utilizes gamma-emitting radioisotopes. The most commonly used radioisotope here is technetium. These radioisotopes are attached to tracers that create radiotracers. Tracers are like special GPS tags that help a radioactive isotope find its way inside your body. They are selected based on the specific process the doctors want to study. For example, fluorine-18 can be attached to a glucose molecule, creating fluorodeoxyglucose. Many cells in the body, especially cancer cells, are highly active and consume more glucose than normal cells, making FDG an excellent tool for diagnosing cancer. When a patient is injected with FDG, the body assumes that it is normal glucose, absorbs it, and the FDG accumulates in areas with high metabolic activity, such as cancer cells. Technetium is commonly linked with methylene diphosphonate, a bone-seeking tracer used in bone scans. It accumulates in areas of increased bone activity, including fractures, infections, and tumors. For those interested, I will provide a link to a video where I explain all the details of bone scans at the end of this video. So, in summary, a radiotracer consists of a radioactive isotope, which creates the image, and a tracer that determines where the signal accumulates to form the image. Once inside the body, both PET and SPECT radiotracers decay by emitting gamma rays, which are then picked up by a camera. But they both do it differently. The fluorine-18 in FDG emits positrons, which will very quickly encounter an electron in the body. When this happens, both particles vanish in a burst of energy and release 2 gamma rays that travel in opposite directions and can be detected by the scanner. A typical PET scanner incorporates hundreds of detectors in rings around the patient. Only gamma rays that interact simultaneously with a pair of detectors are recorded. These trajectories trace back to the point of annihilation, allowing a computer to form an image. Here's another picture to illustrate this. Fluorine-18 produces positrons. Positrons encounter electrons and vanish by releasing 2 gamma rays that are detected by a camera. Technetium, on the other hand, produces only a single gamma ray photon. These can be detected by 2 large rectangular SPECT detectors that rotate around the patient, capturing information to form an image. Now that you know how PET and SPECT scans work, you might want to have a look at my nuclear medicine playlist to learn more about a few of its applications.